they have the potential, as been described today, to have really dramatic impact. I thought Michael Zamore did a great job of explaining that they have the potential to have what we call an ATM effect, which is, frankly, I don't care that my bank has computers, but I'm darn sure I want my money whenever I want my money. It's just that they need to have the bank's computers to get what I want. So having consumers be drivers of improved information technology is great. Personalized medicine, privacy because you control your own records. All these things are terrific. Taking that down and saying, okay, what does this mean for the individual, and particularly for the disability community? I would start by saying the disability community, at least for the 10,000 patients I saw, many of whom had various disabilities, it's an extremely heterogeneous group that have many different challenges and really are just a subpopulation of consumers who themselves are an extremely heterogeneous group. So saying, what will work for the disability community, frankly, is a challenge. But there are some things that are absolutely clear for all consumers, and particularly folks with disabilities. Accessing the system is really a pain. If you have mobility problems, if you have vision problems, or if you have cognitive challenges, getting to the emergency department to see an insensitive emergency medicine doc is a real challenge. And so having access to these kinds of things online has just massive potential. That's the good news. The bad news is that for all practical purposes, PHRs simply don't exist. They are conceptual at this point for 99.9% of the population. And there are very good reasons that they don't exist. It isn't an unknowable thing. They don't exist for good reasons. And some of those reasons, the disability community can particularly be forthcoming with. But the principal reason is provider disengagement. I mean, the cold, hard reality is that there is not an overwhelming demand by consumers for personal health records. In fact, for the most part, they don't know what they are. And unfortunately, consumers, for the most part, are largely in denial of their needs, of their health, and their need for health care. Half of medications in the United States that are prescribed aren't taken. Half the population is obese. Half of women who've been treated for mammograms 3 years out don't get screening mammograms. We do a lot of work with the American Cancer Society. So expecting people to be demanding of something that they're inherently in denial of, again, looking at the general population, is tough. Subpopulations are very tuned into their health, but the general population is not. The second thing, and I think Congressman Kennedy does a good job with this, I mean, physicians do what we pay them to do. If you don't pay them to offer online systems that connect people with their records and to intelligent reminders, even the simplest thing, I mean, how many people would really get their teeth cleaned if they didn't get the postcard from the dentist? And yet in medicine, we have none of that. So obviously, this would be a tremendous advancement forward. It has lots of potential value to various subgroups. They simply don't exist for the most part. But the good news is they're going to exist, and they're going to exist for the reason that's been mentioned by Tom, which is that the employers are pulling their hair out watching healthcare costs go up and their employees completely disengaged from their care. And so if you look at RFPs that are coming from employers to health plans, 90% of them have a personal health record component. And the employers are smart people, for the most part. And they're now saying, well, it's not enough to offer one. Are you getting uptake? Now, the problem that the health plans have in trying to roll out these PHRs, and they've all rolled them out, right? My Aetna, my Cigna, my UHG, my Blue Cross Blue Shield, they're out there. They're all over the place. I mean, if you walk down the street of the world of healthcare, you're going to trip over a PHR. But nobody's using them. Why don't they use them? Because the docs aren't playing. As one of our users say, if I have this great electronic PHR, but when I go to the doctor's office, they hand me a blank clipboard, what good is that? Or turned around, a PHR that's not connected to your provider, doesn't have to be a doctor, but your provider is like an ATM with no money in it.